Hello, this is Arin.
And Shritan.
We are raising awareness on melanoma. We are participating in the HOSA Future Health Professionals Club, where we are in a competitive event called Community Awareness. In this, we are performing activities in order to raise awareness.
We have Dr. Heffernan here, who is a specialist in dermatology. We are creating this podcast to educate people in our community about how the melanoma process works and prevention.
We are going to list a few questions that we will ask Dr. Heffernan to answer.
Hi there, I'm Dr. Linda Heffernan at Forefront Dermatology. I've been dermatologist for about 10 years, frequently doing skin checks and treating a lot of melanomas here in clinic in our office in Cary, North Carolina.
So we are going to be asking questions to Dr. Heffernan. We have a list of questions here that we're going to be asking her. So Shritan's going to ask the first one.
All right, can you explain what melanoma is and how it differs from other types of skin cancer?
Melanoma is the most serious form of skin cancer. It's characterized by the uncontrolled growth of the pigment producing cells called melanocytes that are in the skin. Melanoma can appear suddenly without warning, or it could develop within an existing mole. The overall incidence of melanoma continues to rise, and it's more severe than the other types of skin cancer, such as basal cell skin cancer and squamous cell skin cancer, because it has a higher propensity to spread to other sites in the body, which complicates treatment.
Our next question is, we know that sun exposure and tanning beds can cause melanoma, but can you please go more into depth into how they affect the body and cause this cancer?
Yeah, so research shows that experiencing 5 or more blistering sunburns between the ages of 15 to 20 increases one's melanoma risk by 80%. Other research shows that exposure to tanning beds increases the risks of melanoma diagnosis and the risks of being diagnosed with melanoma before age 50. UV radiation is known to cause DNA damage within the cells and rapidly dividing cells, which is the thought behind why it contributes to the development and spread of melanoma. And we know that use of tanning beds before age 20 can increase someone's chances of developing melanoma by 47%, and the risk increases with each use.
So sun exposure and tanning beds have a big cause a greater chance of getting melanoma.
That's correct, and that's your most preventable risk.
Diagnostic processes you go through when somebody comes in with symptoms of melanoma.
So during our routine skin checks, I'm basically monitoring patients for any changes in their mole, any unusual irregularities. If I'm suspicious of a melanoma, then I'll proceed with doing a biopsy. And then this is sent off to the lab and they look under the microscope to see if there's any abnormal cells concerning for melanoma. And it's the pathologist that makes that diagnosis for us.
Our next question is, what are the different treatment types of melanoma and how do they vary depending on the stage of the disease?
So, if a melanoma is caught at the very first stage, which we call in situ, we can simply surgically excise it with 5 millimeter margins, and then we consider that a full treatment. Once the melanoma grows deeper into the dermis, down to 0.75 millimeters or beyond, then we're going to want to refer to surgical oncology so that lymph nodes can be checked for any signs of metastasis. For the patients where the melanoma has progressed to other parts in the body, then that makes immunotherapy and other systemic treatments possible to help the body fight cancer in multiple places at once.
So, how important is self examination and how often should it be done?
Self-examination is very important. It's important to know your moles so that you know what's changing. I always tell people, if you think something is changing, take a picture and then look back at it about a month later. And if there are noticeable changes, then you want to come in to see a dermatologist for a biopsy. Taking pictures is the best way to monitor, and checking the skin every few months for changes is very helpful in early detection of melanoma.
So, do you think everyone should be doing this?
I think that if there are any particular moles concerning someone, they should keep a close eye on it. But as far as in general self skin exams, we recommend starting that at about age 20.
Our next question is, how frequently should individuals visit a dermatologist for a skin check?
We generally recommend around the age 40, starting with annual skin checks. And then we can decide how frequently somebody needs to come back, depending on the level of suspicion with the moles and things we see on them. However, if somebody has an immediate family history, so mother, father, brother, sister with a melanoma in their family, I want them to start annual skin checks um, starting at age 20. So we want those people that have the genetic predisposition to start a little younger. Now, once somebody is diagnosed with a melanoma, it's recommended that they come back every 3 months for a skin check because once someone has developed a melanoma, they're 9 times more likely to develop another melanoma. So we do skin checks every 3 months for the first year, then go to every 6 months for 5 years before going back to annual skin checks.
We're sure that telling someone that they have melanoma is very difficult for you as a doctor and to tell their families too. So, how do they cope with this and how do you deliver the news to the patients?
So in my practice, I'm always the person to call and deliver the results of melanoma because it's so important that my patients update all of their providers, their primary care providers, their dentists, to know that they have a melanoma history. So everybody's keeping a close eye on them. So I am the one who delivers this news to them personally. The good news is that most of the time we're catching this very early in clinic and we can just treat and cure with a surgical excision. Yes, we do come across patients that need more extensive therapy, but fortunately, in the area we live, we have a lot of great doctors we can refer to help them with that.
Our next question is, beyond the physical effects, what are the emotional and psychological impacts of a melanoma diagnosis for patients and for their families?
I think for people, the idea that something on them that they might not even feel or notice is growing with the potential to turn into cancer is very worrisome. And this leads to a lot of anxiety for patients because they feel that anytime they have an itch or a spot, that if they've had a melanoma before, this could be it, and it could be another one. And so I really like to reassure patients that if they're coming for their skin checks, they're putting their sun protection on when they're out, they're going to minimize their risk of having a melanoma that progresses. And also, the way that we biopsy and treat these does create scars on patients. So that is, we obviously try to minimize scarring as much as possible, but that also has some psychological effects for people. So we're very we take care in knowing that and just stressing the importance of skin protection while these spots heal.
So there can be many effects, but there are many resources also that help their families, the patients, etc.
That's right.
Another question I have is what do you think is the biggest conception people have about melanoma?
We have people come in here all the time that feel like the damage is done and protecting themselves from the sun isn't going to prevent anything from happening. But the studies have shown that if people later on life and even after being diagnosed with a melanoma previously, if they exercise very good sun protective habits, then they are less likely to develop a melanoma in the future. So just because someone maybe grew up without having that in their daily regimen or their practice, it's never too late to change and start using sun protection. The other misconception is that people with skin of color can't get melanoma. They often have a worse prognosis when diagnosed with melanoma, and they have more unusual areas affected, such as the palms of hands, soles of feet, or under their fingernails. So they need to take caution and get their skin checks as well.
Our next question is, what role does education and public awareness play in reducing melanoma rates?
So there have been great efforts by the American Academy of Dermatology and the Skin Cancer Foundation to educate people on the ABCDEs of mole monitoring. So looking for asymmetry, border, color, measurement, and evolving, so changing lesions. So what to look for, what makes people make an appointment, and we get a lot of people that come in based on that education that's out in the community. The other is, the preventative things like sunscreen and sun protection. People are so much better now because of, public education uh, efforts to encourage people to prevent their risk.
So, do you say there's any developments being discovered for melanoma research and treatment?
Yes, there are. So oncologists are developing new treatments for melanoma all the time. There's been a lot of research done on immunotherapy to help stimulate the immune system to fight the melanoma cells once they've spread throughout the body. And we have seen metastatic melanoma survivors here in clinic that have greatly benefited from these treatments.
So, if it's detected early, would you say these treatments are needed, or are the current ones able to deal with?
Yes. So the great thing about melanoma is if it's detected early, surgical treatment is the cure in over 90% of the cases. So then these immunotherapies and systemic treatments aren't needed.
Our last and final question is, what message do you have for people who may be concerned about their risk for melanoma or want to learn more about prevention?
We always recommend strict sun protection. So avoiding sunlight from in the main hours of direct sun exposure between 10 a.m. and 2 p.m. and using an SPF 30 or higher on the face and body, wearing sun protective clothing like hats and UPF 50 sunscreen rated clothing is number one, protecting yourself from the sun. We all recommend not using tanning beds or any artificial UV light exposure, as that can increase the risk of melanoma as well. And if anyone is concerned about a changing spot, certainly anything symptomatic, itching, burning, or bleeding, we recommend they get in with a board certified dermatologist for evaluation and to take pictures and monitor and know your body, do self skin checks so you know if something's changing, you can get in and be evaluated.
Thank you so much, Dr. Heffernan. This was really helpful. We were able to ask many questions. We have a lot of insight on how melanoma works now. So thank you so much again.
Thank you for the opportunity. It's always great to kind of educate the community about this because it is one of the most preventable cancers with, strict sun protection, early detection, and monitoring. So I appreciate the opportunity. And if there's just one takeaway from this, wear your sunscreen and don't use a tanning bed.
Thank you so much. See you next time.